I found a plastic surgeon who reviewed Matt Rife, an American comedian, actor, some of the changes that Matt has experienced and that everybody can see. Definitely some different facial features. Wow. That middle one, like when we talk about jawline, that's impressive.
Over the years, keen-eyed fans have noticed subtle shifts in Matt's appearance, sparking a wave of speculation about the possibility.
I mean, even there to there, that picture on the right, we've got this begonial angle. That's the part of the mandible, right, that forms an angle right there from the part that goes up and down towards your skull and the bottom that projects towards your chin, right? That is impressive. But you're not seeing the actual bone here. That's the masseter muscle right there. Very nice cheek presentation. Good looking dude.
Has he gone under the knife, or are these changes simply the result of lifestyle changes and natural aging?
That is an excellent question, because lifestyle choices or the natural consequences of aging. These jawbones can grow, change in different dimensions. That growth happens differently over time, and some of the growth stops earlier than the others. Natural growth stops pretty early in life, usually pre-puberty. Then you have the forward and backwards growth. So most of the forward and backwards growth, your lower jaw coming forward, your upper jaw coming forward, usually happens around puberty. Most of that growth happens around puberty, not very much afterwards. In the vertical, our upper and our lower jawbone, particularly our lower jawbone, right, continues to change in a vertical way over time. There's so much individual variation in growth. Some people grow early, some people grow a little bit later. There are averages, but everybody's a little bit different. And I'm a big believer in lifestyle choices like eating, diet, like what our nutrition is and how well we take care of our body, exercise, things like that, that can definitely affect the form.
In 2013, at the age of 18,
he still has those little, the form right here a little bit, come right through down here to the chin, some facial form, and he's got the square face, all right? A square face comes down the side. He even has the general growth pattern, right, that we saw at the beginning, already at 18, but you can tell that his face, it still looks like a young face. He hasn't quite matured into an adult face.
Here is that Matt has high brows. He also has nasal tip bulbosity.
Bulbosity, that's a fun word.
Has full lips, both upper and lower, and he has good lateral eversion to his lip.
Lip thickness, of course, decreases over time. So all these things, very accurate.
If you follow the vermilion border from one side to the other, you'll see that there's red lip showing throughout the entire upper lip. Matt also does naturally have a strong jawline.
There you go. See, this plastic surgeon, he kind of gets it. 18, remember we're talking 18.
2015, at the age of 20, Matt's hair appears stable.
I'm glad that his hair is stable. Orthodontists don't usually mess with hair, so if you have an orthodontist that's telling you that they've got this treatment, maybe like a Herbst, to fix your hairline, run away.
At a Norwood 1. Remember that a Norwood 0 is where you see absolutely no signs of any hairline recession, whereas in a Norwood 1, you start to see some very, very early signs
of a Norwood 2
temporal recession. But in Matt's case, for being 20 years old, this is a very common, normal appearance.
The jawline, right, it's still there. He's got that square face. You have different faces. You have very round faces. You have more narrow faces. He still has that shape right there.
When I look at his eyebrows, I notice that they are horizontally positioned, which is a typical male type of appearance. But when you look at his lateral eyebrows, what you can notice is that there's a decrease in the hair density. This is a fairly common occurrence, especially in men, but women can also get this reduced density to the lateral eyebrows. Most people are not bothered by this feature at all. There are some people who decide to get some sort of fill-in, whether it's with microblading or sometimes an eyebrow hair transplant to improve the lateral eyebrows. But for most people, this is something that they don't even notice and are not bothered by.
And I would watch out if your dentist or orthodontist is recommending those procedures as well, meaning that they can do them for you.
When I look at Matt's philtral length, to me, it appears to be in the moderate range.
The lip length, right? That can get longer over time. Our tissue tends to sag, so our face, nose gets a little bit longer, comes down, everything comes down. We show less teeth over time when we smile. That can sometimes also affect, right? If you have it at an early age or as adults, right? They're like, when I smile, I don't show much of my teeth. Well, that's because aging process, just the natural process, the tissue tends to sag down and you show less teeth.
2016, at the age of 21,
still looks young, but starting to look a little bit more adult-ish in his face, even more square looking, perhaps muscle development.
I see here is that Matt does have upper tooth show on repose. So when he just parts his lips, you can see the upper teeth, and it looks to me like he may have had veneers somewhere around this time.
Okay, so at age 19, age 21, in 2 years, some extra growth, some extra maturing, facially speaking. And then he's exactly right. He had a central diastema between his upper incisors. Not uncommon. And then you can barely see, right? There's different heights to the teeth that he has. And then you go over to age 21 and clearly, right, his teeth are closed. That can be braces or Invisalign. Sometimes people just use veneers because they don't want to go through braces. They've got, an important career that they've got to pursue and they can't do braces or Invisalign. And then you notice that the teeth now are at a much more symmetrical height. That doesn't mean that all the teeth are flat across. Usually the lateral incisors are a little bit up compared to the central incisors. Great smile.
This type of upper tooth show is something that we see in many models, both male and female. In 2017, at the age of 22,
that type of jawline, right? There's not really much that you can do to get that.
When I look at Matt's nose, he does have a slight dorsal hump, but he really has no nasal changes when I compare.
Look at that difference that was 19. At age 19 versus 22, you can just tell that he still looked like a young kid.
His prior appearance. But I do see some signs of possible cheek and jaw implants. There is a contour change in the lateral cheeks and in the gonial angles of his lower jaw. Compared to, say, this image from when he was...
Bad lighting. This is hard. It's hard to compare. You got the light from behind, you got the light in the front. You can really see all the curvatures of the face. To me, this right side doesn't look like it's way out of the ordinary.
20. When you follow the contour of his lateral face down from, say, the temples all the way to the chin, what you'll see is that there's now more of a prominence around the lateral cheek and then also right here at the angle of the jaw.
Not saying that you couldn't get lip or cheek jaw implants to enhance, but I think that's kind of a bad photo to compare.
Ways that people can enhance their jawline. There are other surgical options, and these include lifting tissue. Lifting tissue is something that you consider usually in older patients. After a certain age, usually the tissue starts to sag, and so you can go through like a facelift or a neck lift to lift the tissues back and to get the jawline definition back. Another surgical option is to remove excess tissue, such as fat or some portion of muscle that is in excess in the area under the jawline. Yet another surgical option is a sliding genioplasty. This is an
This particular type of surgery, it looks like they're doing an advancement of the lower jaw. So folks that have a recessed jawbone, right, recessed lower jaw usually have excess overbite, what we call overjet. When you're an adult, look, we don't love sending people to surgery, but sometimes for the overall cosmetics, for the function and the predictability of outcome, it makes sense to at least consider having surgery to bring that jaw forward. So what they did, they're showing a cut in between the bone there, and they put a plate across it to kind of push it forward, and then they've done it even more, a genioplasty, where they've cut the lower portion of the mandible near the chin, and they bring that forward, and they have little plates that are screwed in. That can do what he talked about. One, it can change the bite, right, so that your teeth are fitting together, but it can also affect, whenever you remove your jaw bones like that, right, it changes the way that your tissue rests on your face.
Bone is partially cut and moved forward and then resecured with plates and screws so that it's now in its new position. Doing a procedure such as a genioplasty will often make...
There's the recessed jawbone right there. Whew, way back like that. Totally improves the jawline. I mean, obviously this is artist's rendition. That's the effect that can have. Just doing a genioplasty right through there probably won't make as big of a difference as if you brought the whole mandible forward.
Filler. Filler can be in the form of a fat transfer. It can also be hyaluronic acid, which is the usual stuff that people are injecting, such as Restylane and Juvederm. Also, some people will inject Sculptra or Radiesse into the jawline as well. These are all options to make the jaw appear more prominent and to give it proper shaping if that is the desired goal. Keep in mind that anabolic steroids can also create changes to the jawline. And this is because anabolic steroids usually promote muscle growth. As that happens, different muscles around the jawline, especially the masseter muscles, will hypertrophy, and that could change the appearance and make it look more robust.
Hypertrophy? What does that mean? Generally speaking, get bigger.
And then we get to exercises that people can do often at home to improve their jawline. But the question is, do they really work?
Do they really work to change the jawline? Look at the way they have represented these jawbones. The one on the left looks like the jawbone is like way down, and the one on the right has brought the lower jaw in particular forward.
Mewing, right? And that's basically taking the base of the tongue and lifting it up. So temporarily, it does look like a sharper jawline, like a more defined jawline as well, but it's highly unlikely that doing that type of movement, even if you do it repeatedly all day long, that it's going to result in a more permanent change where all of a sudden the base of the tongue is going to be in a higher higher position.
Mewing is all the hype right now too, but he's exactly right. Mewing, there is an emphasis on a particular posture of the tongue, but to actually see changes are as dramatic as we're seeing with Matt Rife, highly unlikely. You can change the soft tissue and you can even change some of your bone, particularly while you're growing, but if you're done growing, then sorry Charlie, it's just not gonna work. Not gonna work predictably without surgery. And if you go back to that picture here, right here you got the tongue and the red, it's trying to push up. There's no amount of tongue pushing up, right, that you could do consistently enough, probably providing enough force to actually get your jawbone to like go up that much. That is a little much. There's no scientific evidence that suggests that that will happen, especially, I'm particularly talking about if you were an adult. You've already gone through puberty.
It's highly unlikely that doing that type of movement, even
this jawline improvement is pretty impressive. Especially if you're going through puberty, there's some pretty great changes from a bony standpoint that can happen while you're going through your major growth spurt. This is natural growth that's happening, okay? You see this guy right here? Look at the changes there. So we got 7 years old and then 12 years old, and you can start to see a little bit more of the jawline during that time. That makes sense. And then that's 15, so another 3 years. It's getting towards the end of the growth spurt, that's what they're saying. And then you go to age 18, so another 3 years, and you can just see the difference in the facial features, and that's all natural growth. So is it crazy to have just amazing growth that your lower jaw just like comes forward a lot, your bony features become well defined, your soft tissue as an adult matures a little bit more and changes? Is it crazy to see that kind of change? I don't think it's crazy. Check this out. This is called a ceph tracing over here. That on the left side, black is the original at 11 years and 10 months. And then at age 14 to 11, you see that the mandible, the red, it like came forward about 7 millimeters. That's huge. And that kind of growth, that kind of change can affect its overall presentation, your facial form. And then you look at the other side on the right, and you can see that in this case, the growth of the mandible was more backwards and downwards, not as much backwards as downwards. And again, that can change the overall appearance of your mandible, of your jawline.
if you do it repeatedly all day long, then it's going to result in a more permanent change where all of a sudden the base of the tongue is going to be in a higher position. It has no reason to remain at that higher position, even if you consistently try to get it up there, right? As you do that, you can look more presentable potentially for some pictures if that's what you're going for. But then when you exhale, you're going to release and it's going to go back to its original position. So something very similar happens in the case of mewing.
Mewing as an adult, is there a harm? Unlikely. Are you going to get results that you see on Instagram and social media? It's more of a good posture, suck in, and then you let it go and it all goes back to where it was. Mewing, it seems like if there is going to be a positive or more significant effect, it would need to be applied while the patient is growing, prior to either right around their major growth spurt.
There are also jaw devices such as jawcercise. These jaw devices are ones where you bite down on the object, and by doing that repeatedly, you're exercising mostly your masseter muscles, and the masseter muscle will then hypertrophy. It will get to be a stronger muscle over time, but the question is that a good thing? Because as you use that muscle over and over, you're going to potentially stress your TMJ, right? That's a temporomandibular joint. That can get arthritic, it can cause pain. That's something you have to watch out for as you're doing these types of exercises in hopes of a more improved jawline.
And I don't think that your masseter muscle necessarily improves your jawline. Maybe it gets a little more bulbous out here, that's your muscle getting thicker. Hypertrophy brings up a good point though. Lots of people come in to the dentist, the orthodontist, oral surgeon dealing with pain, facial pain. Part of the reason why they feel pain sometimes is because they're squeezing so much associated with stress. There's lots of different factors. Anyways, if you're talking about exercising your jaw, right, your muscle, not your jawbone, but the muscle associated with your jaw, you have to understand that just like any other muscle, you could get sore. If you really work it and you put a lot of stress on your joint, it could lead to more irreversible type of pain, symptoms associated with the joint. So just be careful. Is it really worth it?
2018, at the age of 23, what I see is that Matt has some potential mild bilateral upper eyelid ptosis. And
this doesn't look crazy like if he really did have late growth spurt, right? A late growth spurt. And this can happen with some boys. They get into their late teens, they still haven't grown, and then they get 21, 22, 23, and boom, finally turn into the man.
Seeing this based on the supratarsal platform height. For some people, this can give off a sleepier type of appearance. Many people find this to be an attractive feature, and this is something that has to do with a slight weakness of the upper eyelid. And that levator muscle can be tightened in a surgical procedure, but many people decide to just leave it alone.
And again, orthodontists do that.
Back to age 20, Matt now has a more robust.
I think it's bad comparison because you got the light that's in front versus the light in the back, and that changes the way you can see all of the outlines of the face. But if you got rid of this red line right here, I think you could see that the general shape of the face is very square. Even before at age 20, it's still there.
Mid-face. His cheeks to me just look fuller, both in the lateral aspect and the medial aspect. In 2019, at the age of 24, what I see is that Matt now has a more demarcated depression in his mid-face. So between the cheek complex and the lower jaw, there's now this hollowing or this depression. Now,
well, for one, this picture looks like super enhanced. I can't tell. It's like an Instagram filter.
This could be the effect of the implants, or this could be the result of buccal fat removal. In 2020, at the age of 25, I see no change, and that's the same.
Okay, age of 25. There are some people, like I mentioned before, that are very forward in their growth. That's genetically programmed, and there's some influence, right, from environment, but there's not a lot that you can do that's been proven to be able to control your mandible, whether it grows forward like this, kind of comes forward, or and the angle in particular versus, you know, growing down like this. He has got a very forward growth. Did Matt Rife, did he get jaw surgery, have some sort of implant or filler and other procedures? You know what? It's very possible, because those types of things can definitely have the effect of sculpting and changing your total face. It can affect the tissue, it can affect the bones. But the changes that he experienced, not considering the enhanced photos and things like that, is that way out of the question? Based on the growth that I've seen through lots of patients in understanding the way that mandibles and upper jaw bones and teeth and tissue change over time, is it crazy to expect something like that? I don't think so. Again, the jury is still out on whether or not Matt actually had those procedures done. But in my opinion, after you're done growing, there's not really much that you can do to change the actual jawline besides what you eat and how you exercise, and if you get surgery, to have like the same kind of dramatic changes that you do from when you're like, you know, 7 and you go all the way to 18 or 20, right? Those are huge changes. If you've got concerns about your bite or your facial form, go check in with your local orthodontist. He'll team up with either an oral surgeon, a plastic surgeon to help you get to the bite and the smile that you need. That's all I got, just a little PFOing so you know where you're going. Packard out.